Hello. On behalf of the Laupus Library Diversity Committee, I want to thank you for attending our virtual roundtable discussion today, Coping Through the COVID-19 Pandemic, Diverse Experiences. Before we get started, the Laupus Library Diversity Committee acknowledges the Tuscarora people who are the traditional custodians of the land on which we work and live, and recognize their continuing connection to the land, water, and air that Greenville consumes. We pay respect to 8 recognized tribes: Cohee, Eastern Band of Cherokee, Halawasaponi, Lumbee, Meherrin, Occaneechi Band of Saponi, and Waccamaw-Siouan, all nations and their elders, past, present, and emerging. Today's session is being recorded. Our invited panelists today are Dr. Ashley Britton, Dr. Irma Corrall, Dr. Karlene Cunningham, and Dr. Brandon Kyle. Dr. Britton is a clinical assistant professor of psychiatry and behavioral medicine for the Brody School of Medicine. Dr. Corrall is an associate professor and director of the Division of Behavioral Medicine, as well as the assistant dean for diversity and inclusion at the Brody School of Medicine. Dr. Cunningham is a clinical assistant professor of psychiatry and behavioral medicine for the Brody School of Medicine. Dr. Kyle is an associate professor of psychiatry and behavioral medicine for the Brody School of Medicine. We thank them for making time and for their willingness to share with us today. Before we jump into the roundtable discussion, I would like to acknowledge the members of the Laupus Library Diversity Committee. The committee is co-chaired by Andrea Bristol and Alexis Moy, and the members are Jamie Bloss, Lane Carpenter, Carrie Forbes, myself, Amanda Haberstroh, and Mary Roby. The subject of today's roundtable discussion is the experience of our panelists in coping during the COVID-19 pandemic. This last year has affected all of us in a myriad of ways, much of it unexpected. The Laupus Library Diversity Committee would like to ensure that our participants today are aware of services available to them. For students, ECU offers the ECU Center for Counseling and Student Development. Their phone number is 252-328-6661. These counseling services are covered by tuition and student fees, so there is no additional cost to students. Sessions are also confidential unless you pose a risk to yourself or others. Services include brief individual therapy, substance abuse assessment and counseling, group therapy, collegiate recovery community support, outreach programming, crisis intervention, referrals, and workshops on coping skills. They are available for virtual appointments through WebEx. Please visit counselingcenter.ecu.edu for more. For employees, ECU offers employee assistance through Guidance Resources. Their phone number is 833-743-8183. They can be reached 24/7 and consultations are free. Services include confidential emotional support, for instance, to help with coping through anxiety, depression, stress, grief, loss, life adjustments, and relationship and marital conflicts. They also facilitate work-life solutions by providing qualified referrals and resources for almost any need. Please visit guidanceresources.com for more information. Thank you. Now, please join me in welcoming Dr. Britton, Dr. Corrall, Dr. Cunningham, and Dr. Kyle.
Okay, so hopefully everybody can see my slides that I'm putting up here, and I am going to go ahead and get the first part of our presentation started here. So our plan is that we have some information that we're going to go over together, but then certainly have some time at the end for discussion as well. The broad outline of what we're going to be discussing will be starting with just talking broadly about COVID-19 and mental health before discussing a little bit more specifically about how that impacts some different groups of folks. Also talking a little bit about what's ahead, and then also some strategies for coping or managing through the pandemic as well. So first up is just to touch briefly on the subject or the concept of how COVID-19 has had an impact on mental health, as well as some of the role that telehealth may play in that. So if you have been feeling sad, stressed, anxious, burnout, or any other variety of things during COVID and wondering, like, am I alone in that? Certainly you are not. We have a variety of studies that, although we're only really a year into this, have looked at this in different ways. Now, some of the specific numbers that some of these different studies throw out there may look a little bit different, and that's because of some differences in just the methodology of the way that they conduct the research. But a pretty decent approach or look at this comes out of the Centers for Disease Control, or the CDC, and they looked at symptoms of anxiety and depression that people were reporting throughout the time of the pandemic, compared with some data they had collected about a year prior in 2019. And what we saw was an increase from about 1 in 10 people in 2019 reporting some significant symptoms of depression or anxiety, up to about 4 out of 10 people reporting symptoms like that. And of course, as you see, I have on here not just the increase in the report of depression and anxiety symptoms, but also problems with using a substance like alcohol or drugs, problems related to PTSD or symptoms related to trauma or PTSD, increased thoughts of ending your life or suicide. Like, we see an increase in a variety of these concerns during the time of COVID-19. Also, for what it's worth, although we oftentimes think about or talk about the impact of COVID-19 on mental health, I think it's also just worth noting that we've also seen that for people that had pre-existing mental health concerns, that has been correlated with a higher risk of getting COVID-19. This increase then in mental health concerns we're seeing during the pandemic then has led some people to talk about a second wave that's coming. Now, when we say second wave throughout the pandemic, what we were referring to is that how the pandemic, there could be an increase in cases, and then the case numbers start to go down, and then we start to see an increase in the number of COVID-19 cases. But in this case, what we're talking about more so is that there's concern that we're going to be seeing a second wave of concerns, not related directly to COVID-19, but to the mental health problems that were tied into COVID-19 for people. I spent some time working in the VA hospital in San Antonio, Texas, in the late 2000s, early 2010s. And certainly during that time, we saw an increase in the mental health needs for veterans returning from OEF, OIF. Even as those conflicts started to wind down in Iraq or Afghanistan, we were seeing an explosion in the number of veterans that were needing services for mental health concerns related to having served in combat or in a war zone. And certainly, I think there are some parallels here that, although our case numbers are starting to go down, hopefully with vaccination, we're going to continue that trend. There's a mental health second wave that I think we need to be aware of. Also, although I'm not going to spend a lot of time here per se, and I certainly don't want to steal anybody's thunder coming after me in terms of talking about some of the disparate impact of COVID-19 on folks, but certainly that is something that we also see. We see that this doesn't just impact everybody exactly in the same way. And I think it's important to understand, why is the pandemic having an impact on people's mental health? Certainly, there's just the fear or concern about getting COVID-19 itself. Although that's going to affect some people a little bit differently, that's all a concern that we can share to a degree. Also, there's been an upheaval or a significant change that's required us to adjust and adapt. Now, that's happened or come differently for everyone, but I don't think that there are many people that would say that their life starting after March of 2020 looked exactly the same as it looked before March of 2020. And along with that, we've also seen the need for things like social distancing or social isolation and quarantining and isolation and stay-at-home orders. And we know that when people isolate, and particularly when they feel lonely when they are isolating, that's going to lead to poor health outcomes in general. But we then don't see that spread evenly across age groups. Actually, the group or age range that is most at risk for having more symptoms of anxiety or depression are actually younger adults. So although the risks that are posed to them in terms of getting ill with COVID-19 or then getting a serious illness or hospitalization or death with COVID-19 is some of the lowest, some of the anxiety and depression that they're reporting is some of the highest. And you can think about, I think, in part how that has been more disruptive to have college classes canceled, trying to do remote learning, online learning, a lot more socialization that may take place at that time of life is something that means that there's an impact there on anxiety, depression that other age groups may not see or experience the same. Certainly people who've experienced a loss of job, their own, or a loss of job in their household, these people have been more negatively impacted, which makes sense in that we look historically, things like the Great Recession, the Great Depression, that there's an increase in stress, depression, anxiety, suicidality associated with these significant economic downturns. People who have been essential workers, people who are unpaid caregivers for adults also report more mental health symptoms. Certainly impacting children, families, parents differently. A lot of school closures creating significant disruptions. That means that there's been a disproportionate impact on women and on mothers. Also, I think something else that doesn't maybe get discussed enough is that not only has COVID-19 had a disproportionate impact on groups of people in terms of death, but we have to remember that for each death associated with COVID, there's on average about 9 people, 9 family members, 9 loved ones who remain after that. And this hasn't just had the impact on starting a grief or bereavement process for those family members, but it also had an impact on even being able to engage in those things surrounding death, being in the hospital with somebody when they pass, being able to be part of a funeral or celebration of life or rituals that may go around the body of the deceased, having all of that disrupted and upended as well. So just kind of keep, I think, in the back of your mind moving forward that when you look at the projected number of deaths related to COVID that we've had, multiply that number by 9 to get a clearer sense of like the community and family impact of some of these people that have died, deaths related to COVID. And then also just thinking with that, so there's obviously an increase in the mental health concerns that we're seeing, which has led a lot of people to seek out services for mental health. And that's good. As a mental health provider, we want people when they have mental health concerns to seek mental health services. However, that's also been something that has been disrupted by the pandemic. A lot of providers and clinics may have switched to doing almost exclusively telehealth services. Some other clinics may not have switched to doing exclusive telehealth services, but may be doing some telehealth, some in-person visits. And if you're coming into the clinic, typically people are needing to get screened at the door, get their temperature taken, wear masks. Now, thankfully, even before COVID, there's literature around telehealth and telemental health in particular to suggest that it is as effective as in-person mental health services. People tend to be as satisfied with it. The outcomes, improvements people see tend to be the same. So if you're looking at getting telehealth services for mental health concerns, that can be an effective or a good option. Of course, we also need to acknowledge that that's not equally good for everyone. You know, accessibility can be an issue. Now, certainly for some people, telehealth or telemental health increases their ability to access services. You don't have to worry about getting into a clinic for a scheduled appointment, transportation. However, not everyone has equal access to the internet and to services that allow them to do that in terms of technology. There are some laws and regulations that sometimes make it a little bit more challenging for folks. In particular, although there's been a little bit loosening of this restriction, a lot of places you need to be located in the same state as the provider that is offering those mental health services to you, or at least the provider giving you those services needs to be licensed in the state that you're in. In the past, although again, this is something that has been improved or loosened a little bit during the time of COVID, is there have sometimes been some challenges in getting reimbursed or those services paid for in the same way. Also, people are not always equally skilled with all the technology that goes into mental health services that are done in terms of telehealth. But even looping back into something I was talking about earlier, and that is that disparate impact on people that are in that age group of like 18 to 24, 25, you can think too, then if there are restrictions on being able to practice mental health across state lines, if you have students in college in one state, move back to another state, they were getting mental health services where they were in a college, they may not be able to see that same provider they were seeing now that they're in a different state. If that provider at the University Counseling Center they were seeing isn't licensed in the state that they've moved back to. So it's not something that's equal across the board for everyone. And certainly also it's important to make sure that if you're not as familiar with this, that not all telemental health services are created the same. The research that looks at telemental health, does that work, does that help, is talking about essentially doing a traditional session of therapy, like 45 minutes to an hour over Zooms, and talking to the person at the same time they're seeing and hearing you. That's different than a lot of the apps or other things you might get on your phone out there. And those things aren't bad. Those things can be helpful, but I think it's important to be clear that when we say that telehealth can work for people the same as in-person services, that we provide clarity that means synchronous, the same time audio and video, essentially doing 45 minutes to an hour of a session like over Zoom or a similar kind of platform like that. So those are just some broad outlines of some things, but now we're going to move into talking about some issues with culture, and I'll turn it over to Dr. Corrall, but keep advancing the slides for our team here.
Thank you, Dr. Kyle. Can you go to the next slide, please? There it is. So in my section, I'm going to be discussing some unique issues that have impacted diverse populations during the pandemic. Next slide, please. So one of the first things that we saw at the beginning of the pandemic was fear of people of Chinese descent, and at times fear of all Asian people by extension. Now, this was due to the virus originally being detected in China, and this fear led to increased harassment and hate crimes against people of Asian descent. This was reported not only in the United States, but also in other nations across the world as well. This was really widely decried as xenophobia, or the fear of foreigners, by scholars who study this phenomenon. But even after the virus rapidly expanded outside of China and Asia, poor treatment of people of Asian descent continued for some time, and it is still an issue today. Now, in the US, just months into the pandemic lockdown, the other thing that arose was a series of very high-profile incidents that highlighted the ongoing problem of systemic racism in the US, specifically related to some of the instances of police brutality that we saw over the summer. Now, protests erupted all over the country, and in the background of a deeply divided nation that was gearing up for an election, there was a deep sense of isolation and fear and outrage that was occurring in many communities of color. So this second pandemic, the name that was given to systemic racism, this dramatically increased the emotional burden that many were already feeling just because of the pandemic alone. So specifically, many communities of color were hit very hard with the initial job losses that occurred at the beginning of the pandemic as the service industry shut down. Now, this was certainly felt by all people in the US in some way, but some of the early data suggested that people of color were overrepresented in the unemployed sector at that time. For others that were essential workers that did not lose their jobs, there were problems with appropriate protection at the workplace at the beginning of the pandemic, meaning that many essential workers were put in situations where their risk of contracting COVID was very high. So this meant that the virus began to spread very widely in the households and in the communities where essential workers live. So then this became even more troublesome and problematic when we started to see really good consistent data that people of color were dying at much higher rates than other groups of people in the US. And again, this sort of tied back to that second pandemic. Questions about systemic racism in healthcare really arose and started national conversations at that time. So on the whole, experts really were in good agreement that the burden of the pandemic was heavier in some communities of color. And from a wellness and a mental health perspective, what this means is that the stress of the pandemic was experienced in a layered way. For some that were already feeling overwhelmed by the pandemic itself, the addition of these extra layers was just too much, and it led to significant mental health declines. In our region, we certainly saw that a lot of people of color who had previously received mental health care returned to care during the pandemic, but we also saw lots and lots of new referrals for new patients that had never been in care before and were being sent for the first time. As we spoke to many of these patients here regionally, they reported that the cumulative load of all of this stress had pushed them to a point where they recognized that they needed some help from professionals. Next slide, please. Now, the other phenomenon that deeply impacted all people as the pandemic went on past the first few months was how divided we were as a nation about what we should be doing to combat the pandemic. So some people felt really strongly that we should be very, very restrictive, as some other countries were, while others didn't want any restrictions at all. So this really led to a lot of infighting within our country, and it often caused rifts with coworkers, family members, and even strangers online, where a lot of this fighting ended up occurring. So when we think about the fundamental questions of how do people decide that they need to change their own personal behavior to protect their own health, psychologists for a long time have used a model that they call the health belief model to explain why two different people can interpret the exact same situation very differently. And so if you look sort of within the purple box here as I continue explaining, essentially psychologists believe that in order for people to want to change their own behavior, 5 conditions have to be met. You have to believe that you are susceptible to the disease in question. You have to believe that the disease is severe. You have to believe that the benefits outweigh the barriers, and you have to have what we call self-efficacy, or the belief that you have the power to make a change that will lead to a good outcome. The problem is that there's a lot of modifying factors that impact these 5 essential things that must be present. And so, for example, age emerged as a huge thing at the beginning of the pandemic, where younger people felt that this virus would not impact them at all, so they didn't necessarily feel motivated to take action, right? We saw that play out in a lot of college towns like Greenville. And so our personal characteristics often change how we feel about these 5 things. And this process is also vulnerable to issues related to misinformation and mistrust, which can also sway our decision about what we need to do. So even in a situation where all people all over the world experience the same thing, not all people felt susceptible or believed that the situation was severe. Others felt that they would be losing more than they would be gaining by agreeing to public health measures. And some also felt pretty hopeless to change anything, so they didn't feel empowered to take any actions. So what this means is that there was a lot of diversity in what people decided to do for themselves and for their families. And there was also not a lot of consensus about what we should all do as a country or as smaller communities like regions or states. So all of this diversity and sort of ideas was really experienced as extremely stressful by many people. And that also added an additional layer of emotional burden on top of what everyone was already experiencing because of the pandemic. Next slide, please. Finally, it's worth noting that this diversity of responses was replayed all over the world. Many countries selected different strategies of how they wanted to handle the pandemic, and the media messages that were sent out really differed across the globe. Again, some falling on one side of the spectrum of really advocating for lots of restrictions, and others being on the completely opposite side of not wanting any restrictions at all. And as we saw that the vaccine rollout approached, there continued to be very different points of views that were sort of reported all over the globe. And so this really impacted immigrant populations in a significant way, in that for new immigrants to the US who still view a lot of media from their countries of origin, sometimes they were really receiving very opposite messages. And this led to additional confusion and mistrust, and also just a sense of not knowing what the right thing was to do. I will stop there for my section and turn it over to Dr. Cunningham.
Hey, so I'm going to actually start talking a little bit more about what we're doing to kind of combat COVID-19, especially kind of in these next steps. So next slide. Okay, so what is next? So since December and the first authorization or emergency use authorization of a vaccine in terms of the Pfizer vaccine, the vaccination effort has become really kind of front and center in terms of how it is that the globe, not just the United States, is going to be able to somehow achieve some sense of normalcy. And so currently we have 3 vaccines in the US that are approved for emergency use by the FDA, and so the Food and Drug Administration. Those include the Pfizer vaccine, the Moderna vaccine, and the now newly authorized Johnson & Johnson vaccine. And so for these vaccines, there are a lot of questions and things that folks just generally have that maybe are not aware of all the things that go into making a vaccine. And so a lot of people have discussed just the speed in which we were able to go from not having any therapeutics or anything to treat to now having some therapeutics in terms of supportive therapies that maybe shorten the duration, severity. But then also on top of that, how quickly can we go from that to having a vaccine that maybe would prevent infection or significantly reduce the likelihood of severe disease or hospitalization or death? And so that's kind of where we're at right now. And this engendered a lot of anxiety. Next slide, please. So vaccine anxiety, this is, again, that feeling of uncertainty, of worry, just kind of feeling on edge related to the idea of vaccine. Now, this anxiety can come from lots of different places. A lot of people right now are really focused on the idea of vaccine hesitancy. So especially within communities of color, there is a tendency to be very hesitant or just reluctant to trust that this vaccine or the vaccines that are available have gone through the appropriate screenings and testing, that it's actually going to be helpful, or it's going to even be something that won't actually cause harm. And now, again, anybody can experience hesitancy related to the new agent or vaccine, but we are seeing this kind of at an increased rate in terms of in communities of color, especially given some of the historical context. But I really want to stress it's not just historical. There are ongoing issues and impacts and struggles between communities of color and healthcare industry that reinforce a lot of this mistrust. And so you'll see in the media, they oftentimes talk about kind of the historical context. These things happen in the past. That's why people today are very mistrustful and often missing out that there are still significant issues of discrimination, disparities that are occurring in our current healthcare system that also add to hesitancy in trusting vaccination and leading to a lot of anxiety about that. Now, anxiety could also be coming from the access. So for those that maybe have decided that, yes, I've looked over the information, I think this is the best next course, I want to be able to protect myself and family, but when can I get it? And so given that the vaccine rollout has been designated by each state, there are definitely different categories, groups, and kind of levels of rollout that is actually happening. So currently in North Carolina, we are in group 3, and so this is essentially opened up to essential personnel as well as teachers, which was again added to this group a little bit later on and things. So, but the criteria continue to change as to who actually has access. As I was coming in today, I was hearing that Alaska has now opening it up to pretty much anybody that wants a vaccine is now able to get a vaccine. And certain states don't even limit it to residents of that state. So anybody that's in that geographical area is going to be able to get a vaccine depending on if they meet the criteria of that state. And so some people have gotten into the practice of being able to look at what's going on in their state, who might have availability, but then also looking at the surrounding states to say, hey, can I drive to a border city that maybe be able to qualify to be able to receive a vaccine at this time? Again, because of some of the variations in access. Now, say you do meet the criteria that is based off of that state, you then have to be able to find a place that actually has vaccine to give. And so being able to navigate the systems that states have put in place, many of them are online, and the timing has to be booked. They release a number of slots and you have to be quickly able to kind of get on that. And then there is the aspect of, okay, of those people that are not technologically savvy at being able to navigate these online systems, who's calling them, who's going into their communities, who's knocking on their doors. So this also impacts a lot of the uncertainty in terms of what this is going to be like, how this is going to be, what is the timeline, are we actually going to get to the place where all those that want to be vaccinated are vaccinated, and is everyone getting the information that is accurate about what their options are. Now, for the communities or individuals that have been vaccinated, one of the more interesting pieces, especially amongst those in groups 1 and 2, were feeling the sense of guilt of them feeling like they were able to access something that other people were not able to, that they were able to, maybe be that much safer, even though they were able to access it sooner because of their increased risk. It still feels bad that you might be the only person within your family that is available, or you have access to getting that vaccine, and worrying, okay, well, I'm going to be okay, but what about my husband, my child, my aunts, my uncles, my parents, and trying to kind of grapple with that. And that then leads to additional anxiety. Next slide, please. So these two pictures are from about March 5th, and this is coming from the Department of Health and Human Services, North Carolina Department of Health and Human Services dashboard in terms of the vaccine rollout. And the dashboard allows you a lot of real-time information as to how things are going in rates of testing, infections, hospitalization, as well as the vaccine rollout. And what you're kind of seeing here is first just North Carolina as a whole. And so those counties that are darker are showing those kind of a higher level of vaccination, right? And so Pitt County is actually doing generally well, given that Biden has created a pretty massive vaccine rollout aspect. So we have the Greenville Center, Convention Center, where it made a massive community rollout aspects. That they are making smaller community rollouts that they're doing, and partnering with a lot of community organizations to be able to specifically target communities of color. And you're also then going to see the breakdown in terms of the first doses that have been administered by racial demographic. Now, this breakdown doesn't match completely the kind of racial demographic of North Carolina, but it is it's better than what a lot of folks have actually expected it would necessarily be. And because the health disparities and the disparate impact of COVID-19 and the potential for limited access to communities of color, despite their increased risk, there's been a lot of concerted effort in terms of partnering with communities, community organizations, getting folks on the ground to really provide additional information and even providing additional slots to make sure that folks have access. Next slide, please. Now, the reason why vaccination has become so important is this idea of hope of getting back to some semblance of quote unquote normalcy. And so the CDC just submitted new guidelines or interim kind of recommendations for those folks that have been fully vaccinated. And they define folks that are fully vaccinated as for those that have gotten the Moderna or the Pfizer vaccine, both doses and 2 weeks out from the second dose as fully vaccinated. And for the newest vaccine, the Johnson & Johnson vaccine, being 2 weeks out from the single dose as being fully vaccinated. And in their guidelines, or at least these first recommendations, they're allowing folks to be able to interact. Two people that have been fully vaccinated can interact in small kind of private areas with each other without a mask. The idea of being able to decide level of risk by the individuals that you will be around and if they've been vaccinated or not. It definitely gives us a glimmer of what we might be looking towards, but also a question mark in terms of hope, because there has been a lot of attention to the variants of COVID-19 that are popping up and how well our current vaccines are going to kind of measure up against these new variants. Next slide, please. So finally, I wanted to just kind of bring back the idea that all of these things are changing, right? And the whole aspect of adaptation or adjustment to a situation comes in stages. And, you know, this is a model that is kind of based off of kind of a chronic illness or a risk factor for disease. And, you know, this all brings on a certain level of stress. And so when we have this health threats, stress that is coming up, we first are looking at what's going on and we're like, oh my gosh, I don't know if I can handle this. And then we start kind of moving through it and we start to maybe gain some mastery, figure some things out, make some changes. And then we again are able to appraise or look at the situation again and say, you know what, okay, I'm getting a little bit better at this. Maybe I can make these tweaks here. This seems sustainable. And then we start this process of coping. And the adaptations that really kind of evolve in that is the aspects of our self-esteem, maybe utilizing aspects of our spirituality, maybe finding ways that work better than others, because there's lots of different ways that are helping us cope. I know back in the initial aspect when everyone was missing traveling, all of these places were doing kind of the virtual tours of things. And, you know, I sat through some of the virtual tours, but that just ended up actually making me a lot sadder watching the videos of different places that I had been before. I'm like, oh, I remember doing that. I'm like, so that was not a really effective way for me coping. But I found other ways to be able to rediscovering new nuances and places within North Carolina. That was like, oh, well, I had never seen that. And this is socially distanced and I can do that. That helps to address that piece of missing. And then the kind of the social integration. So, you know, that has, again, has been a little bit harder, the social isolation that was inherent in trying to protect yourself. Now, this model doesn't take into account kind of the constantly changing, parameters of which we're trying to kind of live our lives between the different mandates that come down, the variants that are coming out, school being in, school being out, school being virtual, school being not. And so we're constantly kind of moving through this aspect. So finding additional ways to cope is very, very important. And being able to maybe even think outside the box in terms of where we might be able to access that is good as well. And so that actually leads us into Dr. Britton's talk, and so I'll turn it over there.
So I'm going to talk a little bit about coping strategies, some different emotional and physical experiences you may have been dealing with, and then we'll talk about how coping can present itself both generally and some long-term strategies, and then I'll review some of the resources that were discussed at the beginning. Next slide, please. So we're living in unprecedented times. This pandemic has brought a variety of health, financial, emotional hardships to individuals across our country and across the globe. And the pandemic has had such a major effect on our lives is because it's this continued uncertainty that we're dealing with. We're running this marathon, we don't know the total distance of the race, and so it's sort of hard to pace yourself when there's not really an end in sight. And so what's resulted is this phenomenon called pandemic fatigue. And so it's that collective feeling with the low motivation, lack of energy, no longer wanting to comply with the safety guidelines, the 3 Ws, because people are wanting to get back to that sense of normalcy. We found in various studies that have been conducted over the past year that for many people who either both had pre-existing mental health issues or people who've never had mental health issues, rates of anxiety and depression are significantly higher, and particularly among those young adults, as Dr. Kyle mentioned earlier. And so we're seeing this increase in stress, anxiety, depression, and when not managed properly, it can be really crippling in this time when life is already very challenging for most people. So we're trying to figure out what is this, how can we get back to normal, and this fatigue is making it even more difficult. Next slide, please. So Dr. Kyle mentioned, or possibly Dr. Corrall mentioned, layered stressors throughout the pandemic. And so it's all these different things that are compounding on each other and feeling really quite cumulative, which is going to result in heightened emotions that also have some physical consequences, leading not only to the anxiety or depression, but maybe also increased muscle aches and pains, GI upset, increased fatigue, and other symptoms you may or loved ones may be experiencing. So some of these layer stressors associated with the pandemic are personal stress. So we talked about that feeling of disconnection, that isolation, fear of getting sick, financial stressors from that loss of income, reduced hours, or being laid off, that familial stress that might be happening at home of having to balance working from home, caring for children without a break 24 hours a day, assisting with educational needs on these new virtual platforms, maybe having some technological issues that are adding additional stressors, on top of your normal household responsibilities. We have cultural stressors fueled by concerns over changes occurring in local communities, if favorite businesses or restaurants will ever reopen and survive the pandemic at all, for people who enjoy going to the gym, being physically active in specific settings. Will these places reopen? What would that look like? And how will your community as a whole bounce back financially from the hardships created from the pandemic? And so then that cumulative stresses, all of that encompassed together, as well as our media consumption experiences, which can greatly add to our levels of stress and anxiety. So when combined, these stressors make living through this pandemic somewhat traumatic for most people. If you carry a perceived or real threat that this pandemic has over our personal safety, health, and lives, it can very much be considered a traumatic event. So that adds on to that emotional distress that people are finding themselves experiencing. Next slide. So given all this, what are we trying to do? So we're looking at coping and how can we deal with this. And the graphic on the right, you'll see some general coping strategies that should be used really kind of any time. Finding some relaxation activities, yoga, meditation, turning to music, finding maybe online courses that can help with self-improvement and wellness, and finding ways to add more routine or structure to your day. And that can be another stressor of not having that stability and that routine that you're used to having. Looking for means of hope, finding new hobbies. These are some of your general coping strategies you may already be using. But given the nature of this pandemic and that we don't know how long it's going to last, some people have been finding that they've exhausted these typical coping strategies and they're just not as effective. So thinking about this extended problem, you have to think about implementing some more longer term strategies. And so these 6 were created by some of the staff over at Vanderbilt. So first, thinking about self-care not being optional. So we have to take charge of our own well-being. We can't expect even the most caring employers to be responsible to keep us comfortable. Part of our professional obligation is to strive for our own well-being. So personally and professionally, knowing what you need for yourself and taking that time to help deal with any mental distress, physical distress, rather than feeling guilty about, oh, I shouldn't take off work, or I'm fearful of mentioning that this is happening. This is a really important time to make sure you're taking care of yourself to reduce the chances of burnout. Setting attainable well-being goals and implementing that plan is critical. So these goals might include exercise, meditation, improving your nutrition, yoga, mindfulness, prayer, some of those other activities, connecting with others in socially distanced or safe manners if you're both fully vaccinated. But finding other intentional forms of restoration. So finding that right match for you and then intentionally doing it regularly to put it as part of your new routine. Planning to use that paid time off to recharge. So in years past, you may have saved vacation days for travel or going to the beach, but that may be less realistic for the foreseeable future. So enjoying those experiences with your family, your friends, your pets. Taking that vacation from news and social media. So this is a really important one right now. Everyone's being bombarded with lots of negative or sensational headlines over the past year, and that adds to that daily increased stress and anxiety. And there's really little need to know the daily tally of infections or deaths unless your job is dependent upon those figures. And then ongoing political discord will continue to follow whether you look at it daily or not. So intentionally having time away from your screens, having time away from the social media, some of the news information, or even using platforms that look at less biased information. Another one is seeking diversions that are healing. So again, spending time intentionally, doing things that give meaning to your life and to your family. And then creating some predictable routines. So we're focusing on managing the things that you don't have, or the things you do have control over, and not focusing as much on things you don't have control over. But ultimately, you want to be kind to yourself as you're trying to adjust to this ever-changing challenge. Next slide, please. So, during this pandemic, perceptions of control become really important. Your locus of control is largely based on your personality. And so we have what's called an external locus of control, where you feel as if things are happening to you and you have no control of what's happening. So things are happening from an external perspective. Or an internal locus of control is the belief that you have control over what's happening around you. So during this time, it can enhance that sense of an external locus of control. And often this feels really disempowering. So it's important to focus on what we're able to control and hone our ability to control these factors. So that might be some of those things on the inside of the circle of having a positive attitude, following CDC health recommendations, turning off the news, limiting social media consumption, finding fun activities. And as you continue to increase your sense of control, you can develop that constant daily routine that's maybe ideally similar to what you had before the pandemic. So keeping a regular sleep schedule, taking breaks from work to stretch or exercise or check in with your supportive colleagues, family, or friends throughout the day, spending time outdoors, either being physically active or relaxing. And then if you work from home, setting a regular time to end your work for the day when possible. So some of those things on X here are the things you're going to have to let go of. You're never going to know how much toilet paper is available at the store, and you can't control the actions of others. But focusing on those things you can will make the day-to-day less stressful overall. Next slide, please. So as was mentioned at the beginning of the presentation, for students, we do have the ECU Center for Counseling and Student Development Services. These are some of the additional national and local services that they have listed on their website. So I think it's great that they have a variety of resources available. And as mentioned, those services are covered by tuition and fees and are confidential with few exceptions. And they do have urgent support services available as well. If you go to their website, which is down there at the bottom, they have more information about their current spring 2021 programming. Next slide, please. For faculty and staff, as mentioned, if you're finding yourself becoming depressed, more stressed, or just struggling in general with how to cope, ECU's guidance resources, the Employee Assistance Program, is available to set up confidential appointments 24/7. In the middle there, you'll see the different services they provide, and I like that it's pretty wraparound and comprehensive of emotional, work life, financial, legal, because all of these aspects, as I mentioned, are being affected. On the upper right area, you'll see some just other additional mental health resources from the CDC, the American Psychological Association, National Alliance on Mental Illness, and then also from the SAGE hotline for LGBTQ plus and elders who are also struggling during this time. So having other resources available to different communities that are being affected. And I believe that is all from my portion. If we want to go to the next slide, if there are any questions or comments.
People can feel free to ask comments in the chat if they'd like to, if you have any more comments for our presenters today.
So it looks like Amanda commented on the graphic about locus of control. Certainly the locus of control might be different for people in caregiver roles. They'll probably feel a combination of the two with certain experiences that they're having. They're going to have some of that those external locus feelings of everything just keeps happening around them. And then while they're caring for their loved one or whoever else they may be caring for might have more a bit of an internal locus of control, and that what they're doing and their ability to be there for that person because they are in that caregiver role, it really falls on them and they take that higher pressure on themselves. So it's definitely a good point to look at how that could be different for caregivers as well. If anyone would like to add more.
So Jamie is saying, thank you. I found the health belief model and adaptation models very interesting. Thanks for the tips on combating pandemic fatigue as well. I can speak for all of us saying that has definitely been an issue for many, many of us. Are there any more questions today? Okay, well, if not, we just want to thank all of our presenters, Dr. Britton, Dr. Corrall, Dr. Cunningham, and Dr. Kyle for presenting for us today. We appreciate your expertise and your knowledge about all of these topics and helping all of us understand better ways to cope as we continue through this pandemic. The panelists will, Amanda asked one more question. Would the panelists like to share their own strategies for coping?
Well, I can speak for myself. I've found a mix of self-care activities, so things that are just for myself to relax and restore, of having some boundaries when I'm outside of work and on my weekends, kind of treasuring those to have that time to really relax and decompress from the week and focus on maybe light things, not taking in as much social media or news. But then having some fun things like getting your nails done. For me, I know being active at the gym has really helped a lot with managing my stress, since I'm someone who tends to have my anxiety and stress manifest physically. So that's probably been one of the best things to help with managing that as I've been going throughout this time. But I have great support around me. In fact, my colleagues, Dr. Cunningham, Kyle, and Corrall, we, through most of last year, would have regularly scheduled virtual meetings just to check in with each other, because we weren't seeing each other as much in person. And so being able to connect with people and have that additional support has been something that's really helped me during this time.
I have personally spent a lot more time outside than I used to. I've started to garden, and I've taken a lot more walks, and I've started riding my bike again for the first time in like 20 years. And there was just things I hadn't had the opportunity to do. So I kind of try to think of it as a gift of time and approached the challenges in that way.
I guess I was on the bandwagon of a lot of home improvement stuff. So early in the pandemic, I redid my backyard, and I didn't realize how expensive dirt was until I bought like a ton of it, and it was all in my front yard. But that a lot of physical activity in terms of doing that. And I have a little one, so he is 6 and he started kindergarten this year. And so being able to kind of navigate these aspects, and I like to kind of geek out in kind of the science of this pandemic and all those stuff. So it wasn't, while I was able to kind of separate the personal kind of aspects of like, oh my gosh, this is happening to us, I think, by getting lost in kind of the intellectual aspects of those pieces and those nuances, and also being able to just teach my kiddo more science aspects and doing a lot of experiments at home. And that was super fun to be able to have the time to be able to kind of do those pieces and kind of teach about that aspect.
And I'm with Dr. Corrall, and that I have spent a lot more time outside in the past year than would be typical for me, and that's been a really good thing, and that I feel relatively safer, like outside, so it's not gathering indoors with folks, but also just being able to do that has been a nice alternative to feeling like cooped up inside. So when the weather has cooperated, that's been great. When I was doing more working from home, other points during the pandemic, I also tried to use some boundaries there, just in terms of having a location that I was working, and when I was done, just having kind of the symbolism of like closing up the laptop and that's it for the day, just as that sort of stimulus control to say like, okay, so the work part of my day is done. Now I'm moving on into something else. Those have been kind of, I think, the two things that I've used throughout the duration of the pandemic, probably the most consistently.
Thank you. I think that is all of the questions we had. And yes, the recording will be available along with the presentation. It will be available on Teams. Once we have that recording link, we will send that out to the multiple listservs as well. Again, I thank all of our panelists today, Dr. Cunningham, Dr. Corrall, Dr. Britton, and Dr. Kyle. Thank you so much for sharing your knowledge and taking the time to do this with us today. We really appreciate it, and we hope everyone has a wonderful day.